Hello, welcome back to the University of Iowa Healthcare Organ Transplant Education. In this video, we will cover life after transplant. It's normal to have questions, and we will try to answer some bigger ones here. We hope this will help set you up for success. Your education will start during your stay. You will have daily visits with an educator, pharmacist, social worker, and dietitian. It is vital that your caregiver join in learning during your hospital stay. They will also need to get you home after discharge. After you go home, your daily routine will change. To start, you will need a driver to bring you to your visits. You will have weightlifting limits for 8 weeks, but also need to stay active. They will ask you to keep a log of your vital signs and fluids. You will need to do this for the first few weeks after surgery. Return to full physical activity varies. You will need to come to the clinic regularly after your surgery. The visits will be frequent early on and less frequent over time. You will also need many blood draws early after discharge. These can be done close to home or in clinic. These will also decrease over time. You will need visits and blood draws for the life of your transplant. You need to know there is always a chance of organ rejection, even with your best efforts. Rejection is the body's attempt to fight off the new organ. It can happen any time and without symptoms. That does not always mean you are losing the transplant. Your medical staff will see signs of rejection in your blood work. You can help stop rejection. To do this, you must always take your medications as prescribed. You also need to always get your labs drawn on time. Now, to help stop rejection, you will take immunosuppression or anti-rejection medications. This lowers your immune system. Immunosuppression will start when you are hospitalized and will continue for the life of your transplant. Lowering your immune system can cause complications. Immunosuppression can cause infections and certain types of cancer. These medications can also have other side effects. You will learn more about these during your evaluation. You will need to take immunosuppressive medications for the life of the transplant. That means it is important to learn about them. You will also want to know about their side effects. Check with your care team before you start a new medication. It is possible they could affect your immunosuppression medications. Do not stop taking immunosuppression medication unless told to by your provider. Not taking the medications can cause loss of the transplant. Insurance can affect your ability to get these prescriptions. If this happens, you need to call the care team right away. In addition to immunosuppressives, you'll be prescribed other medications to prevent problems, including antivirals, antibiotics, antifungal, and antacids. I know that was a lot of specific information, so before we move on, feel free to go back and re-watch or jot down any notes that you want to revisit. One of the most vital things in this process is your personal caregiver. A caregiver is someone who gives physical and emotional support. This happens before, during, and after the surgery. It is a demanding job, especially for the first few weeks. It is okay for many people to share this role. The caregiver will be intimately involved in the process. They will need to come to all visits with the team. This is so you and your caregiver are both educated about transplantation. Before the organ transplant, the caregiver can provide support for the patient by accompanying them to appointments and speaking with the transplant team, as well as educating themselves about medications and how to care for their loved one in the short and long term after organ transplant. After the transplant, the caregiver can help by ensuring all medications are given properly and on time. The caregiver will also help manage medication and ensure their loved one gets to all clinic appointments and lab draws. At home, the caregiver must make sure their loved one is eating and drinking correctly. They need to stay active, healthy, and get exercise. Caregivers may need to help with daily activities such as personal hygiene, completing the transplant record log, and helping out with daily chores such as cooking, cleaning, grocery shopping, and running errands. But most of all, a caregiver must do their best to remain calm and understanding through their loved one's difficult moments. One of the most vital things for a caregiver is to take care of themselves. To give a loved one the best care, you need rest, nutrition, and exercise. Be open to the warning signs of stress. When this happens, find the source and a way to manage it. Admit what you can and cannot change. Ask for help when you need it, and take help when it is offered. Do not forget to use your backup caregivers or your own support system. It is also important for recipients to reach out to others impacted by transplant. Writing a letter to the hospital staff or your donor family can be a therapeutic exercise after a transplant. The evaluation process can be tough for everyone. The wait can be even tougher. Your success depends on having a therapeutic relationship with your care team. They will be here for you. It's expected that all interactions will be courteous. After transplant, things are largely in your control. This includes your health and the health of your new organ. Be active in your health care. Take good care of yourself and the gift of life you've been given.